Surgery can be scary, so it's a relief when a doctor says your operation was successful. Carrie Simon got the all clear after her heart surgery in 2002. Then, as she lay in her hospital bed recovering, something didn't seem quite right.
The infectious disease doctors come in, 2 of them come in, and they told me that I have some kind of a infection in my sternum where my heart surgery was.
Carrie, the doctor said, had contracted MRSA, a bacteria that is responsible for several difficult-to-treat infections. What makes them so difficult is that they are resistant to many antibiotics, and it can strike anyone at any age.
It's a big problem in athletes, in the pro teams, in the locker rooms. But there's so many antibiotic resistances that are developing, and it could only get worse.
The Centers for Disease Control and Prevention say it's getting a lot worse. Their new report says at least 2 million people in the United States become infected with drug-resistant bacteria annually.
The American population doesn't have any idea of the extent, the numbers of people who are affected by it.
The CDC calls them nightmare bacteria, and they can cause potentially catastrophic consequences. But how do we stop it? Doctors say hand washing and hospital sterilization are 2 ways to prevent infections.
Usually hospitals allow 16 minutes between patients to clean a room. That is inadequate to really clean a room.
How long a specific bacterium or a virus can last in the environment on a surface varies widely from minutes to days and weeks. So hand washing is absolutely critical.
In fact, hand washing is such a big issue because recent studies say that up to 50% of doctors aren't following proper hand washing procedures in hospitals, and that could lead to the spread of deadly diseases.
Something in the hospital gave me that infection, whether it was somebody not washing their hands or a piece of equipment.
Through several operations, surgeons removed Simon's MRSA, and she is now back at home in West Hartford with her husband and 3 healthy children. But others aren't so lucky. 23,000 people die each year as a direct result of these infections. That's more than die from AIDS.
The CDC is scared, and I think they want us, I think it was a real heads up that they want us to pay attention.
The CDC says it wants to raise awareness about drug-resistant bacteria and get the government, doctors, and drug companies to pay attention. Marcus Harun, Q30 News.